Okay, so we're going to show you right now a conversation that we're going to have with every patient that is a new patient or any established patient who has not had this conversation yet. This is a conversation that goes in conjunction with the primary script conversation that every patient in the office should have also had. Primary script conversation being about whether there are any health conditions that the patient has that they would like to get rid of. Now, this conversation that I'm going to show you today is about how our body actually works, and it is typically done on day 2 of the 4-day report of findings. This is a conversation that educates the patient about function versus symptoms and how our offices are different than other offices. Okay, so basically the idea is to sit with the patient and we use a whiteboard, and then we educate the patient, and I'll show the patient this script and actually show while you're doing the script together while you're doing the drawing on the whiteboard. Okay, so here it goes. I'm going to show you how our body functions. Now, here's your brain. Here's your body. Everything that happens in the body is regulated from the brain. And if all the information from the brain to the body actually flows perfectly right, then we have good function. Okay? Most of the patients at this point will agree with it. Always make a point of looking that you have the full attention of the patient. Okay? So, the brain regulates everything that happens in the body, and if everything, the information, full information flows to the body, our body has good function. And another way of saying that is everything happens with ease. Okay? Now, sometimes what happens is that there's an interference that happens between the brain and the body. Now, what are kinds of things that are interference? And I make a point to actually ask the patient rather than me telling them. Now, they may be a little stumped, so then I help them along. So, stress causes interference. Traumas, injuries, toxins, and so on and so forth. You get the picture that there are certain things that happen to us in our daily life that are actually causing an interference between the brain and the body. Now, when you have this interference, what happens to the function? I ask the patient the question. Again, the patient often will say, well, the function is decreased. Great. Or we can also call this malfunction. Now, the next question to the patient is, how do we call it when the body malfunctions, or parts of the body malfunction? We call that symptoms. Okay? And when a patient has a number of symptoms, what is that called? Disease. At this point, the patient starts getting the picture that interference in the body causes disease and symptoms. Now, what's really important to remember is that symptoms only appear once there is 60% interference. Now, how do I know that? Imagine you have a patient that has angina, chest pains. People don't get chest pains until the blood vessels around the heart are obstructed 60%. Okay? So in the body, it always happens like that, that when the function is decreased by 60%, that's when your symptoms start appearing. In other words, when a patient walks into the doctor's office, into our office, and they have certain symptoms, we know that they're only functioning at 40% or less. Got it? Makes sense so far? Good. Here is why our office is different. Here's 100% function. This is 40% function. Symptoms appear anywhere below 40%. So when a patient walks in the office, we know they're functioning at this line or below. Now, where we are different as an office, we want our patients to function at about 85–90%. But here's what happens typically in life. Patients come in, they have certain symptoms, they get treated, and they go just above the 40%, and now their symptoms are gone. What do a lot of patients do? They stop treatment. The realization, though, is when they're just above 40% and they go along, something in life happens causing a bit more interference, and why do they go? They go right below that 40% line. And they're back at the doctor's office with the same problem. And their life goes like that.